I'm Public Health Commissioner Jeff Howard. Today I'd like to discuss with you a topic that has been one of the most challenging issues in public health as well as medicine as a whole, and that is hepatitis C. The United States is experiencing rising rates of hepatitis C virus or HCV infections fueled by the nation's growing opioid crisis. As I've said many times, the opioid crisis is Kentucky's #1 public health issue. This pandemic has many negative downstream effects, which include high incarceration rates, poverty, and adverse childhood events, just to name a few. However, one of the most concerning negative consequences, which happens to fall in the realm of public health, are the infectious complications of substance abuse, which include HIV and HCV. Hepatitis C virus rates are very high in our state, and we often see patients with or who have been recently treated for HCV. This issue is particularly acute in the greater Appalachian region, where the increase in injection drug use has led to more than a threefold rise in HCV infection rates. Hepatitis C is currently the deadliest infectious disease in the United States. It is transmitted by contact with contaminated blood and disproportionately high in those who inject drugs. While hepatitis C used to primarily impact older Americans, the opioid epidemic is now placing many younger lives at risk. Right now, 80% of new injection drug users will contract hepatitis C within 1 year. At least 2.3 million individuals in the country are currently living with hepatitis C, and an estimated 43,000 of them are in our state of Kentucky. Over the past 10 years, Kentucky's incident rate has remained amongst the highest 3 states in the nation. It was #1 for reported acute infections for 7 years in a row. During this time, Kentucky's incident rate has reached up to 5 times higher than the national average. Because of a narrow case definition, actual acute cases of hepatitis C are estimated to be 13.9 times the number of reported cases in any year. And HCV can be lethal. More Americans die from hepatitis C-related morbidity than every other infectious disease combined. That is 60 other infectious diseases, including HIV, TB, and pneumococcal disease. Approximately 20,000 deaths each year are attributed to hepatitis C, which is both curable and preventable. The issue is that this disease often goes undetected. Left untreated, hepatitis C leads to an increased risk of liver disease, liver cancer, and even death. You might be aware that Kentucky is one of the 5 states working with Gilead Sciences on a new project called HepConnect. This is a new 5-year, multi-million-dollar initiative to address the increase in hepatitis C infections and support community partnerships. HepConnect focuses on the expansion of screening and linkage to care, supporting harm reduction and community education, and activating healthcare infrastructure. We need your help to make sure this initiative is a success as we focus on ways to educate and expand the number of healthcare providers able to provide care for people infected with HCV across our state, support the implementation of telemedicine and other innovative programs that reach people where they are, develop local solutions as they can be the most effective in combating rising HCV infection rates. If you would like to learn more about HepConnect, please visit hepconnect.com. That's HepConnect.com. Failing to treat hepatitis C cases as infection rates multiply has severe public health implications. Right now, the cost of hepatitis C in the United States is set to reach $13 billion annually, and the average cost over a lifetime for a young person diagnosed with this disease is over $92,000. Kentucky Medicaid has worked to eliminate barriers to care and liberalized treatment requirements in 2017 that removed fibrosis and sobriety restrictions. We also changed the program to allow primary care providers to treat hepatitis C patients if they are in consultation with a specialist. In 2018, Kentucky Medicaid had treated 2,771 of their enrollees for a total of $75 million. We adopted these changes because we know hepatitis C elimination strategies that provide unrestricted access to treatment save money and patient lives and reduce new infections. Finally, I want to briefly draw attention to why some Kentuckians with substance use disorder may not seek treatment for hepatitis C. That reason is because of stigma of HCV and of their substance use disorder. We must work together to overcome the stigma of substance use disorder. We must ensure that those who need us most know that we are ready and willing to serve them during their time of need, so that they can be healed in all manners and join society as a healthy and productive member. I hope that you will each join us in our effort to reach more Kentuckians, make sure they are screened for this deadly disease, and give them the treatment they need and deserve. This is a public health crisis that needs your attention and full support. Thank you very much. Have a great month.